Good morning, everybody, and welcome to this 5th of July Children and Family Scrutiny Board meeting. I'd like to welcome everybody. My name is Councillor Dan Cohen. I am the chair of this Scrutiny Board. This morning's meeting is being webcast on the Council's website so that any interested members of the public that are unable to join us in person, and we're even better in person, are able to observe us remotely. I will invite everybody to introduce themselves, and there won't be a quiz on this later on, so let's crack on. So we'll go to the left, introducing yourselves.
Thank you, Chair. Hi, everyone. I'm Natasha Prosper, and I'll be clerking the board today.
Hi, Nick Tones, school staff representative, co-opted member, non-voting.
Tony Britton, representing the Leeds Roman Catholic Diocese.
Councillor Karen Renshaw, representing Alzey and Robin Hood ward.
Thank you, Councillor Jane Dowson, and I'm standing in for Councillor Lisa Martin this morning.
Welcome.
Good morning, everyone. Jordan Bowden representing Roundhay ward.
Morning, everyone. And Killamanaka and representing Permanchoffs on Richmond Hill.
Good morning, everyone. Councillor Oliver Edwards representing Guiseley and Rawdon.
Good morning, Councillor John Tudor, substituting for Councillor Gruen.
Good morning, Councillor Bromley, representing Horsforth and Rawdon.
Good morning, I'm Councillor Jonathan Pryor. I'm Deputy Leader with Council and Executive Member for Economy, Culture and Education.
Good morning, everybody. I'm Julie Longworth and I'm Interim Director of Children and Families.
Good morning, everybody. I'm Farah Khan. I'm Chief Officer for Family Help.
Good morning, Heather Thompson. I'm Head of Public Health for the Health Improvement Team.
Morning, Catherine Ingold, Chief Officer and Consultant in Public Health.
Good morning, everyone. My name is Andrew Scopes, Councillor for Beeston Holbeck. I'm here as the Chair of the Adults Health and Active Lifestyles Board. I'm here to join the discussion on vaping. So thanks for having me.
Morning, I'm Laura Whitaker. I'm the voluntary sector representative for Young Life Leeds.
Good morning, I'm Kathleen Ward. I'm a co-opted member.
Good morning, I'm Councillor David Blackburn, finally in Wortley ward.
Good morning, my name's Sandy, Councillor Lay, and I am here to discuss the first item on vaping in youth.
Good morning, everybody. Ryan Stevenson, Councillor for Harewood ward.
Morning, everyone. Rob Clayton, Security Advisor to the board.
Good morning, Councillor Jules Hesselwood, Wheatwood ward. Apologies slightly late. I've been supervising picket lines this morning.
I win the sweepstake. I said you'd get that in somehow. Thank you very much all for introducing yourselves. Item 1, appeals against the refusal of documents.
Thanks, Chair. There's no appeals.
Item 2, are there any exclusions?
There's no exempt items, Chair.
Item 3, any late items of business?
There's no formal late items.
Item 4, does anybody have any declarations of interest? I see none. Takes us to apologies.
Thanks, Chair. Apologies have been received from Councillors Downs, Gruen, Martin, Senior and Smith. Subbing, we have Councillor Dowson in place of Councillor Martin and Councillor Tudor in place of Councillor Gruen. Apologies also from Councillor Arif, Exec Member for Adult Social Care, Public Health and Active Lifestyles. She would have been here for the vaping item. Apologies also from Andrew Graham, Helen Bellamy and Kate Blacker.
Thank you for that. Can I say a big thanks to Councillor Tudor and to Councillor Dowson for coming along to sub this morning, and can I add my own apologies to Councillor Arif. We had an oversight entirely our fault, and it's we will make sure that when we have take this item forward, we'll make sure that she is able to fully input into it, but she was happy for us to go ahead today. So thank you for that. Takes us to item 6, the minutes, which in your bundles start at page 7. I will go through page by page. If there is anything that anybody wants to raise or correct there, this is your moment so to do. So page 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. I'm not just showing I can count, by the way. I am going through page. I'll pick that up in standards as for numeracy. Okay, so nobody's got any items to raise there. Are we happy to approve those as a correct minute? Somebody care to approve that? Thank you. Sorry, Councillor Rachel, sorry. Thank you very much. They're approved. You're turning my microphone off. Okay, that brings us to item 7, impact of vaping on children and young people. Can I thank Councillor Sandy Lay for bringing this or raising this. It interestingly was something that was coming from a number of places. I think it is, in fairness, something we would have looked at, but certainly it was helpful that you raised this in the way you did. Can I also thank Councillor Scopes for joining as Chair of Adults Health and Active Lifestyle Scrutiny Board to input into this today, and we will be able to determine how we take this forward. Rob, before we launch, anything from you?
Yes, thank you, Chair. As you've noted, this came as a result of correspondence from Councillor Lay and then discussion at our June meeting under the sources of work item, where it was agreed to take this item forward. I mean, the cover report that is before us asks, well, sets out a brief summary of the issues that are associated with this problem, and then asks the board for any comments, views as to how we should take this forward. So that's the substantive issue before us, but obviously there's a general briefing provided by colleagues in public health as well. In addition, just something that came up in the pre-meeting this morning, there is a proposal to move this forward via a working group in the future, which would tie in both the interest of this board and, as the Chair's already noted, Councillor Scopes, who's representing the Adults Health and Active Lifestyles Board. So that is something that obviously I will take forward with my colleagues in Scrutiny and the advisor to Councillor Scopes' board, and we will come back with a plan on that to have a joint working group across the boards that then reports back in here. Just to very briefly add in, as the Chair's already noted, my apologies to Councillor Reeve, as well, it was my oversight, so apologies, Chair, for that. Okay.
Thanks, so who's going to lead us off on this? Heather, is that you?
Hey, Catherine Ingold, I'd be happy to start. So first of all, thank you to Heather Thompson, who's here today, and Michelle Kane for pulling this paper together. I'd like to draw attention to 10 points, 10 brief points very quickly. So thank you for your interest in this important matter. We are pleased that the Chief Medical Officer, Chris Whitty, raised vaping in children as an issue in May. Chris Whitty is really clear that vapes have got a really important role in stopping smokers from smoking, but there is no place for non-smoking children to use vapes, and that's something we need to take a close look at. The second point, vapes do contain nicotine, which is highly addictive, and we need to make sure children don't become addicted to vaping. The third point is, as with tobacco, there's increasing evidence of an emerging illicit market in unregulated vape products that we're concerned about. The fourth point, the proportion of children experimenting with vaping, so that's trying it once or twice, has increased by 50% in the last year, but they are from quite low figures, from 7.7% to 11.6%. That's national data. We do have good data in Leeds. We've got a wonderful survey called My Health, My School, and we ask questions about vaping. And in 2022, the prevalence of occasional and regular users of vapes was 6.41%. That compares to 4% nationally, but the national data don't include 16-year-olds. So we think it's about comparable in Leeds. Amongst never smokers, overwhelmingly, the primary reason for trying vapes is experimental, and people try it and leave it. Vaping harms, compared to smoking, the harms from vaping are significantly less. However, it's not risk-free. We don't know the long-term impacts. And Chris Whitty has described it as inhaling air pollution. So the two biggest points I'd like to draw your attention to before we have this discussion really are there isn't strong evidence that vaping is a gateway into smoking. People might try vaping and smoke cigarettes, but this association works both ways. And what we want in public health is for cigarette smokers, to move to vapes as a way to move away from that harm. And the reason we know that is if it was a gateway into smoking, smoking rates would have started increasing or stopped declining, and that hasn't happened. The second biggest point is, I mentioned at the beginning, concerns about sales and regulations of vaping products. It is illegal for children under 18 to buy vaping products that contain nicotine, but we know that children are getting hold of them. There's also no restriction on shop displays, and many shops have really attractive displays of vapes, and the industry is very, very clever in how they market. And we're really worried about the emerging illicit market and underage sales. So that's an area that we really need to focus on. There is lots of action underway already, education materials, presentations to people who work with young people, but most significantly, really working with West Yorkshire trading standards, listening to complaints and notifying traders of allegations and complaints, and trying to stamp out really the availability of e-cigarettes. We're carrying on this work with gaining further academic insight into the issue. We have a healthy schools team who are carrying on monitoring the data around use. We're linking in with the Office for Health Improvement and Disparities around further resource packs. And we are continuing to develop coordinated work with a focus on trading standards and stopping access. So that's an overview of what's in the paper.
Thank you very much for that. I'm going to bring in Councillor Lay before we go any further. Thank you.
Thank you, Chair. And I'd like to just thank the board for considering this item. As has already been stated, there is real and genuine concern, not just from myself, but from a number of ward members across the city of all political persuasions, among our educational partners at government level, and amongst families and parents. It's no exaggeration to describe the production, distribution, marketing and sales of e-cigarettes to young people as a Wild West. And it's also no exaggeration to describe the health effects and harms on young people as a Russian roulette. Depending on where you buy your vapes, how they've been produced, what heavy metals or what other toxins they have in, you really are placing your developing brain and lungs predominantly at risk. We know through modern medicine that a young person's mind and body doesn't fully develop until they're about 25. And we also know that because of their developing brain, young people are more likely to take risks. They're more likely to try novelty activities, which vaping is. And our role as adults in our society is to protect our young people until their body and their brain is fully developed, and to reduce the risk of harm to them. So that's the main reason why I wanted to bring it here. I also think there's a lot that we can do. We know that the government has put out a call for evidence, which is just closed on youth vaping. We know that in Australia, the e-cigarettes have gone to prescription only, and we know the Royal College of Paediatricians are asking for the same in the UK. It certainly would be my first choice. Requires national legislation, of course, but that would be my first choice. That way we can help those adults, including my mother, who had 8 years ago, I suspect, a massive heart attack. She'd smoked all her life. She couldn't give up cigarettes through the traditional methods of patches and willpower. But she was able to give up the more harmful cigarettes through vaping. And over a period of a number of years, she's reduced her vaping nicotine, and she's now effectively just vaping for the habit of something to do with her hands, but there's no nicotine in her vapes. So it has a real role to vapes, and electronic e-cigarettes have a real role in helping adults be weaned off the much more harmful smoking. But it should have no role with young people. The marketing and distribution is shocking. I know of a sweet shop in my ward that above the window has get your sweets here, and below the window has get your vapes here. It is an absolute shocking situation that we find ourselves in. If we don't want to go down the route of prescriptions, we could go down the route of taxing disposable vapes. Young people tell me, and we know from the report on the agenda, that some of these vapes are £2.99 each. If we taxed individual disposable vapes to a level that would take them out of that pocket money range, we could start to make an impact on young people vaping, because they like cigarettes. And I suspect that's why we haven't seen a gateway to cigarettes in this country, because certainly the Centre for Disease Control in America is saying that there is a gateway to tobacco and cannabis use in the US, but their approach to tobacco has been different to ours. So we are pricing young people out of tobacco. That doesn't mean to say that if we had less pricing on tobacco, then vaping wouldn't be a gateway, but we need to make vapes as expensive as cigarettes, in my view. Other things we can do as a council: education and awareness. We can implement comprehensive educational campaigns that target young people, parents and educators to raise awareness about the risks and consequences of vaping. We can provide accurate information about the harmful effects of e-cigarettes and nicotine addiction. School-based programs, we could integrate tobacco and e-cigarette prevention programs into school curricula. We could offer evidence-based programs that address the social and behavioural and environmental impacts contributing to vaping, and emphasise the importance of making healthy choices. And perhaps this one's much more for central government, but perhaps also for local government. We could restrict marketing and advertising, enforce strict regulations on the advertising of e-cigarettes. If we remember what we did with Alco Pops, and yet we're not doing that with vapes, we're effectively allowing corporations to poison our young people with the inhalation of nicotine and other heavy metals and toxins. And yes, we know they're not as bad as tobacco, but they're still bad. And we shouldn't be having, interesting term of phrase, non-smoking young people I have to say, but we shouldn't have non-smoking young people taking up vaping. And I think this is a no-brainer. I look forward to us having a working group where we can tease out what the issue is and how we can resolve it, either as a council and a board. Thank you very much.
Thank you very much, Councillor Lay. Councillor Scopes.
Thank you. I'm hopefully coming in with questions. I guess my interest has come from I'm a parent of teenagers, and I'm aware that young people are vaping in class even, because if you hold it in, the smoke doesn't come out. And I think that's probably I can see the numbers aren't as high as perhaps they might be, but I would suspect that they might be higher than reported just based on indicative evidence from 2 teenage children in a high school that live in my house. Okay, so I guess there's three aspects for me. I think the first one is around what can we do locally, and I think what Councillor Lay said about the advertising, etc. I think we need to look at that, and maybe we need to talk to our planning colleagues as well as our children and families team, because I think what we can do locally is really important. I also accept the education point, but I think there's a real issue, not an issue, a truth that young people will try stuff. So so whether or not we tell them it's bad for you, it doesn't necessarily change a child's behaviour. I think the second aspect is working with our partners, and so I think people like the police, I'd like a conversation with them about the proactive work they're doing to stop underage sales. I'm sure we all have shops near schools that we suspect of selling vapes, and I think that's a real problem, and so I think engaging with them as well. And then the third thing is what Councillor has talked about as well, is around putting pressure on government around national legislation around the advertising, particularly around schools. And again, we've done that with tobacco, and I also recognise that the comments made saying this isn't as bad as far as we know so far as smoking, but addictive behaviour is a real problem, and we don't want to encourage that. So I guess I don't know if the Children's Family team have any comment on those aspects of public health. Thank you, Chair.
I'd just like to come in and just to support the comments that have been made. I think obviously we've got a real role in terms of education. So, providing accurate, factual information about the risks, about the harm. So I think absolutely, we'll welcome the opportunity to take part in a working party. I think as well, it's education professionals, it's educating parents and carers as well. As you've said, these are the people that have got these children in their households. So there's something about being able to educate our families across the city, but very much in support of the comments that have been made and the suggestions.
Thank you. Catherine, Heather, anything from you at this point?
Schoolboy era, schoolgirl era. Just to say, it's really heartening listening to this debate and hearing your passion and your concerns. Councillor Lay, if you want a job in public health, you're welcome. I think you've made some really interesting points. I mean, just to comment on some of your points, national legal changes would make the biggest difference. I agree. Taxing, there's evidence that does work. It's worked in Scotland with minimum unit pricing and alcohol, and Mexico and sugar taxes. It is very effective. Your comment, Councillor Scopes, about advertising, and I think it's a really good idea, and it's something else we're looking at as a council around high fat, salt, sugar advertising, and there's evidence that works. The sneaky thing about this industry is that advertising isn't legal. It's the displays, and I've noticed in our local shop, the display is fabulous. There's all the kind of like rotting eyeballs and lungs have gone, behind the cupboards, and now there's an amazing display of it, and but they would be national legal changes. And your comments around stopping underage sales and education, they're exactly what we want to do. Your comment about the data, the My Health, My School data is self-reported data from school children, so it is what they're telling us, but with our further academic research we can dig deeper. And your comments, Julie, about education and targeting, we can get better and better who we target and make sure we're covering everybody. So they were my initial comments, but Heather is the true expert, who might have other things.
Yes, thank you. And again, thank you very much for your interest in this topic. It's something that's close to my heart, having worked in tobacco control for the last 25 years in Leeds. It's a topic that keeps giving for me. So I think I think the points about legislation and regulation are absolutely key. And I think if we look at what's happened over tobacco control, is our big gains in tobacco control in reducing smoking in people under the age of 18 has been around about access. It's been about restricting marketing. It's largely been as well about the adult population reducing in smoking as well. So that does certainly have a knock-on effect with young people. I think we've got to create a really careful balance here, because we are keen, as Councillor Lay pointed out, about the use of e-cigarettes in helping people stop smoking. We are using that with our Stop Smoking service, and it's a really valuable tool, and it's a tool that's very appealing for people who want to stop smoking. So the work that we do needs to balance with that. But absolutely, the key thing is to ensure that young people who are experimenting, and young people do experiment, we need to make sure that that isn't translating to regular use. One of the things that I'm keen to look at, and we're hoping to get more detailed data through the My Health, My School survey, is to understand exactly who is becoming the occasional and the regular users of e-cigarettes. There's some evidence to suggest that those are children who are already smoking, in which case, you know, if it's going to stop them from smoking, that's a good thing. But obviously what we want to ensure is that young people who are not smoking are not taking up using cigarettes. So I think there's been some really helpful comments and very well-informed comments that we've heard so far. So thank you.
Thank you. Councillor Downs. Sorry, Dowson, apologies. I don't know why I've written Downs. Yeah, so it's not like I've not known you for 12 years.
Yeah, there's only one left the difference. It's all right.
Still inexcusable.
I mean, the first thing I wanted to say, especially as Sandy's in the room, is happy birthday to the NHS. This is a health issue, and from the porters and cleaners all the way up to the sort of main surgeons, everyone who's ever worked in the NHS over 75 years, thank you. And I'm sure that's from all of us, not just from me. But with that in mind, this has been a really good conversation, a really grown-up conversation about the good vapes can do in certain circumstances, but also the harm it can do when they get into the hands of young people in particular. And I've smelt them on the bus, you know, they're fruity and they're nice. And you talked about Alco Pops, and it's going to that same market, isn't it? It's marketing is key. So first thing I'd like to do is just get some comfort that this will continue to be part of the My Health, My School survey. Also, can I ask, what is a short SMART survey, and what is that going to consist of? I'd like to know a little more about how you're working with trading standards, and the conversation about national policy. Obviously, we can send messages through to national government about the policy, and no doubt this is coming from across the country about changes need to be made. But also, what can we do locally? Because it's all very well identifying a problem, but it's awful if you can't do anything about it locally. I'm sure we can. And what have we got in mind, and who are we going to speak to try and make those changes? Thank you, Chair.
Would you like us to respond? Yeah. So vaping will continue to be part of the annual survey, so we'll keep a close eye on that data. And the short SMART survey is to be designed where it's having a focused, asking focused questions of schools. So that's to be designed, I think. Yeah, just checking I'm not directly involved in all the detail. And what can we do? They're the things that are outlined in the paper, really. Education directly with children and families, education with people that work with children and young people, monitoring the data, working with academic colleagues to understand it more, and working with trading standards. They're the things we're in control of locally. But as Heather said, the big changes will come nationally, and that requires political pressure and keeping this high on the political agenda. I don't know if you want to add.
Yes, I can just add a bit to that. In terms of the My Health, My School survey, we have we've re-looked at the questions that we're asking about vaping. One of the things that we're really keen is to get more insight as to where young people are actually purchasing their vapes and getting their vapes. So we've re-looked at the questions and we're aligning those to the national survey that's conducted by ASH, so we can sort of get a comparison as to what's happening in Leeds compared to what's happening nationally. So that those new questions will commence within, I think it's within next year's survey. In terms of West Yorkshire Trading Standards, we work with colleagues across the region. So we're working with colleagues in Bradford, Wakefield, Kirklees and Calderdale, and we jointly commission West Yorkshire Trading Standards from the Public Health Departments. That has primarily been around about underage sales of tobacco and illicit sales of tobacco as well. Trading standards have been, in fact, we met with them yesterday. We had a discussion about the emerging market, about illicit vapes in particular, which are the totally unregulated vapes, and also looking at the potential for test purchasing around in response to any complaints about underage sales. Interestingly, we're having more complaints about underage sales of vapes than we are around underage sales of tobacco now. So trading standards are responding to those complaints. What we're hoping to do in Leeds is to do an uplift. Anecdotally, we've been told that the city centre is experiencing groups of young people coming into the city centre because vapes have been easily accessible to them. They've been sold vapes. So we're keen to actually do a concentrated piece of work with West Yorkshire Trading Standards to actually do some work around retailer education and to also do some work around responding to complaints and test purchasing. So we're looking to uplift that activity within this year.
I would say, given that you see so much of the marketing now is directly aimed at young people, that there's an uplift in complaints about underage sales is really no surprise. I mean, the marketing is unambiguously designed to attract young people. It's genuinely outrageous. Councillor Blackburn.
No, it'd be interesting to know if we're getting any levels of addiction. I mean, you're saying it's not going on to people necessarily smoking, but it'd be interesting to see about the addiction. I mean, I as a former smoker, I haven't had a cigarette for the best part of 2 years, but at some point today, I'll want one, but I hold off. Now, the fact is, if young people are getting addicted to, and it's the nicotine in it that I want, and if young people are getting addicted to that nicotine and it's giving them a safe feeling, then we need to do something about it. I mean, I've got to say, it seems to me ludicrous that we allow vapes to be in the flavours that they are, because at least one thing, the great put-off when you're a teenager and you have that rebellion and you have your first cigarette is it doesn't taste very nice. It's until if you let it get nicotine get older, then you get addicted. But it doesn't taste very nice. But these flavours do taste nice, and they've still got nicotine in them. So I think that there's a problem there. But as I said, I think we need to look at the level of addictions. And I think Sandy had a point. If you're a teenager who's rebelling and you want to do something that your parents don't want you to do, or adults don't want you to do, if you can go get something that's cheaper, then you're going to get that. And I think the point is we've got to be looking at price levels similar to what cigarettes are.
In many ways, of course, these are the inhaled version of Elco Pops. Councillor Venner.
Thank you, Chair. I wasn't intending to speak on this, but I felt moved to, having heard all the contributions. I started smoking when I was 16 and I smoked for 20 years. And I was quite struck by what Councillor Scopes said about children you can tell children something's harmful. I was an intelligent academic child and I still smoked. I think children are drawn to things that seem edgy and rebellious and feel invincible. So I'm in my 50s now and I worry that I'll die of lung cancer because I smoked for 20 years. But even in my 20s, I couldn't envisage being in my 50s, let alone I'd worry about longevity. I'm really interested in one of the comments about it not being as bad as smoking. one of the things I've read quite a lot about this, because obviously there's a lot in the Sacre press as well as in the mainstream press. And one of the differences with smoking is you can only smoke so many cigarettes in a day, bluntly, without feeling sick. I think the average full-time smoker probably smokes 20 a day, whereas one of the articles I read was about a child who died, and their parents said they vaped constantly. It was a young, a child about 8, well, a young adult, I think they were 18. And their parent had said to them, if you smoked, you wouldn't smoke this many cigarettes, but they were vaping constantly. And I wondered if there was any knowledge around that, actually, about that difference, that you can actually take in more, in a sense, if that makes sense. Personally, I'm really in favour of regulation. I mean, I'm a socialist, I'm quite in favour of regulating, but the thing that stopped me smoking and stopped many people smoking was when you couldn't smoke indoors. And it just became more and more of a hassle, having to go out of the pub and smoke in the rain. You really know you're doing it just for the addiction when you're you're having to leave buildings. And I think with that regulation has come a real cultural unacceptability. Smoking has become more and more culturally unacceptable. And it's unacceptable, I think, in most demographics and most age groups now. I don't think any smoker would now dare to go to a non-smoker's house and smoke indoors, which we used to do all the time. It was perfectly normal that people would have ashtrays in their houses for when their smoking friends and relatives came round. So I think regulation is really important, but I also think we need to find ways to make it culturally acceptable. I think some of that comes from regulation, but some of it comes from other things, including education. But I think we need to recognise the limitations in that, because adults for generations have told children what's good for them and not good for them. And, young people are daft and feel invincible. Thank you.
Anybody want to come back on that before we move on?
Would you like me to come in on the dependency issues first of all?
Yeah, it'd be really helpful. Thank you.
So I think, where do I start? So firstly, regulated vapes contain less nicotine than cigarettes. We know that. There are regulations about that. However, we are very concerned about the illicit market on this, because we know that there are high concentrations of nicotine in some of the illicit products that have been seized. So that is a concern. In terms of how vapes are used, you make a very interesting observation that yes, they are used more as a grazing type approach to nicotine use, in a similar way in which we would use a product such as a nicotine replacement therapy product. So they're tended to be used to sort of put a baseline of nicotine into the system to be able to manage a nicotine dependency. So in that sense, yes, they are nicotine dependent forming. Cigarettes are used very differently, in that you will get a sudden, very quick hit of nicotine from smoking. It'll take 7 seconds from taking your first drag to it hitting the brain. It's incredibly, I think the tobacco industry has been incredibly creative and extremely clever in their research in how to actually deliver nicotine extremely quickly. And, cigarettes are known as a very effective nicotine delivery device. Vapes don't work in quite the same way. So they'll tend to put more of a baseline, which is why you end up with this grazing rather than used like a cigarette. So there will be a dependence forming aspect to that. However, in terms of the addiction, one of the properties that you would look for an addictive substance is the speed of response. And so I think the evidence is sort of saying that yes, they are dependence forming, but they're not likely to be as addictive, if that makes sense. So hopefully that's answered the question there. I think the interesting point about flavouring that Councillor Blackburn raised is that yes, the primarily young people are wanting the fruity flavoured ones. I think 60% of young people are saying that they preferred those fruity flavoured type vapes, which are really being pushed with the bright colouring, with the marketing, with the flavouring. Less appealing to young people, interestingly, now are the vapes that are tobacco flavoured or menthol flavoured, and there's a very small proportion of children who are saying yes, we like those ones. So that's an interesting observation there. So hopefully that's answered your questions around, or the initial questions about dependency and flavouring.
Thank you for that. Councillor Edwards.
Thank you, Chair. A quick one. Julie, you talked about test purchasing. within local communities, but also in the city centre. And what can you tell us a bit more about what penalties are there at the moment in terms of shops or businesses which sell to children under the age of 18? So what are the penalties at the moment? And is there a case for wider test purchasing, undercover checks, particularly in the way that has been done, for example, for alcohol or for cigarettes? What plans are there to expand that? Because it seems to me that there may be a role there, and not only within the city centre, but also within local communities potentially. In the city centre, you might have bigger businesses that are selling, but in local communities, you've also got word of mouth as well. And in terms of setting an example, in terms of enforcement, what plans are there? Thank you.
Okay. In terms of the way test purchase and prosecutions work, is that initially West Yorkshire Trading Standards would respond to a complaint around an underage sales. And the first step of that is to go and do a retailer visit and to explain that they're not supposed to be selling to underage, and to have assurance that staff have been appropriately trained and that all staff are aware about the legal requirements for that. If there are further complaints, then a test purchase is normally the next step in being made. And if that retailer sells to and continues to sell to under 18s, then there is grounds for prosecution if that is within the public interest. So as far as I'm aware, at the moment, my attention was drawn to a prosecution that was made a couple of weeks ago, as far as I'm aware. And I think the penalty on that was a £2,000 fine to the person who actually sold the product. And obviously costs were paid with that as well. Now, I suppose it's whether that £2,000 fine is enough to become a deterrent for people continuing to sell e-cigarettes. So I guess it depends on the size of the business and how that might be impacted.
So just to come back on that, just to be clear, that's a 2,000 fine to the person who sold it. Was there a fine for the business?
I don't know. I'd have to go back and have a look at that. I can certainly send you the article that was published.
Thank you for that. Jules, Councillor Hazelwood.
And yeah, there's a couple of things that I would like to bring up. As a parent of two teenagers too, one now 17, so in the middle bracket of the figures we're looking at, I can definitely say that the instance of vaping is higher, much higher than the report states. Luckily, my children don't do it. I know that for a fact, after questioning them and living with them. But they tell me stories of lots of their, friends or school friends, acquaintances at school who do this, So I absolutely, I know we have the My Health, My School survey, but reality says that those figures are a lot higher than we're reporting. So we've got a much bigger piece of work to do there to uncover the reality of what's happening. So that's definitely higher than the figures that we've got. With the test purchasing, I was at a packed meeting last night, the police and communities meeting in my ward last night, and I was talking to the PCSOs about this as it came up, and they've been doing some test purchasing in our ward, and luckily the shops have come back great. They're all observing the rules and not selling to underage children. And that came back really well. But some intelligence did come out there last night about the city centre and that someone's grandchild that's where they're going. And they did mention some of the street traders as well. So that's just a bit of intelligence to pass on, that I think the city centre, what you're saying about the city centre is definitely where groups of children are going and are able to purchase these vapes. So that came up last night. That's definitely something to pick up on. And just from an environmental point of view, I know you mentioned the environment, Sandy, as you were speaking to us about this. Again, this has come up from one of our community groups, so litter pick. Around schools, high schools, they go litter picking, and the amount of these disposable vapes that are just discarded around high schools is just unbelievable, you know, and I'm not saying it's just one, I'm saying, you know, more, you know, litter picking groups saying the same about all groups, all schools rather, about these secondary schools. I found a couple in my house from my children's friends, and, you know, I'm looking at them thinking, what on earth is this, you know? So yeah, around schools. So again, I think there's some work to do with schools on this, because obviously we know it's happening, but you know, we've got the evidence. They're all being thrown on the floor as they leave school or go to school in the morning. So yeah, I think that there's a lot more to this than we've got in this report, a lot more digging to do. Yeah, but some, you know, we've got that information and we can work on it and act on it.
Thank you for that, Councillor Heswood. Councillor Stevenson.
Thank you, Chair. I don't know what Councillor Bennett was smoking. It can't be very strong at 50. It's wow. I smoked it. Yeah, well, I'm going to say, because I was smoking something stronger. I'm 15 years younger. I think look older, but my experience is a bit different at school. I started obviously illegally, but smoking around 13. On my way to school, there was 2 newsagents, and like most other young people at the time who were a bit wayward, used to call in on your way to school and buy a packet of cigarettes and last you the day, and there was no questions asked. Clearly that was illegal, and at the time there might have been checks that were going on, but not very well. Fast forward 15 years, and the platform is very different for children today. That they don't have to go to the newsagents illegally on the way there. They can turn to Amazon and online purchasing outlets. I've just had a look quickly now on Amazon, and all the usual child-focused branding is there. I can buy something for £11.99, have it delivered to my house within 13 hours. There's a caution on it that says it may cause an allergic skin reaction. There's nothing else that says about health. It says that there's apparently a child-friendly lock on it, but it never says anywhere in it that there's any restriction on purchasing. I've put it in my basket already. I'm not going to purchase it, but if I were, there's nothing in that process that restricts anybody under 18 from purchasing that. So my question is around trading standards, because I think the sort of analog way of dropping by a newsagent or a specialist vape shop, which are popping up all over the place with rather horrible neon signs, etc., is very analog. So how do trading standards respond in a digital age? And what discussions do we have with the distributors like Amazon? And have we explored, for example, I think it's the case that the council actually leased the Amazon building to Amazon. I seem to remember there was some sort of connection there. So are we exploring any enforcement action around the large companies that are delivering these things to children underage?
That's a really good question, and we don't know. So thank you. I mean, the 3 things that I've taken away from this, I know I'm not rounding up, but just to mention is Councillor Venner, I think your idea about making vaping unacceptable and checking policy organisations of policies that are partners to see if vaping is allowed where smoking isn't. That's something we could look at the evidence base to see if that will make a change and take that on. The data that you mentioned, we can do a deep dive. We can look at academic literature to see if children are too not frightened, but don't want to self-report about vaping, and check our data. And I think it's a brilliant idea about online sales. We haven't thought about it because we think about Leeds, you know, we think about bigger picture stuff, but we think about what we control. I do know from personal experience that you have to be 18 to buy alcohol, but I'm not sure what happens with vape, so we can look into that. So thank you.
I'll just come in on the interestingly, and I must admit I was very surprised about this, because I thought that internet would be actually the prime site for young people to purchase vapes, and it suggested that it certainly is for adults, but young people are tending to use shops rather than online platforms to purchase vapes. Again, this is something that we want to explore a little bit further through the My Health My School, but I was surprised at that. I had wrongly thought that that the online platforms would be the most popular places for children to purchase, but apparently not.
entirely without proper data to back this up. I suspect the reason for that, speaking as a father of 4 young people, is of course Amazon gets delivered to the house, which does leave a fairly high chance of parental interception, as I can discover by the fact my son ordered a telescope completely randomly, which is now being sent back. Had he got it first, it wouldn't have been. He decided he was having his own bar mitzvah present. Jackie.
Hi, it's just more or less comment really. I've got 4 young people, and vapes at the moment is the latest trend. If you're in, like my children are a bit older, they're over 18, but it is the latest trend with all those age groups, and it's cool. It's easily got, but coming from the work point of view, I work in a shop, and there's 4 things you can't hand over the counter to a child. That's alcohol, tobacco, vapes, and medicine. So there are 4 things. So when someone comes in, where it comes up on the screen as this person over 18, and you have to get their ID and date of birth. So it's clearly shown to us anyway that children should not be buying these products. So that is there already, just to let everybody know that it is. But I think for children, the thing is, my young people, or my young lot, keep telling me that, oh, it's not dangerous. It's fine. We can have this kind of thing. It's fine. It's safe. Also in the shop, people come in and ask them, can we have some health bars? They're called health bars. You know what I mean? So it's promoting health, it's promoting goodness, it's promoting, things that aren't a danger. So maybe the promotion of these items needs to be looked at, because it looks, at the moment, people think they're healthy for you, they're good for you. It's the latest trend, it's good. Best, let's have them with our friends. But just a comment really more than anything else.
Thank you. Please.
I just think it's really interesting listening to the conversation. And I think for me, it just reflects the need for that whole system approach. So we're thinking about police, thinking about trading standards, thinking about public health, thinking about the role for children and families in terms of education. The conversation that we've been had around the city centre, makes me think about our youth workers who are working with other local authority teams who know the city centre, know the children in the city centre. So I just think the opportunity for a working party to bring the system together, really to have the conversation and to agree our response in the round, I think is, really, really helpful suggestion. I think the conversation just highlights the need for that this morning.
Thank you for that. Nick.
I think to add a little narrative from what we're hearing out of schools, one of the issues is that students are aware that these things should not be used because they are hiding that they are doing it. Another issue, which could be to do with trading standards, is that some of them are designed to look exactly like highlighters. So they can basically be used in a classroom without anybody noticing. And this is one of the issues that staff are saying, is that they are finding this. I think Councillor Scopes mentioned that if you can avoid the smoke appearing and it just looks like somebody's, well, we've all sucked on the end of a pen and kids are sucking in the end of highlighters, but they're actually vapes. They seem to be being used in school from the information that's coming out to us as another way of getting away with something that is wrong. So it's not necessarily just the health implications, it's the fact that, oh, guess what I got away with in class today? I managed to vape in 5 out of my 5 classes today. And I think that's a fairly major issue as well. And I would, go along with what several people have said, telling children something is wrong is a surefire way to make them do it more. So I think we do need a very, very clever and concerted effort to look at this, because even when smoking became unacceptable in public, students in schools still find ways of being able to do it because it is part of the rebellion. And I think vapes have now taken on that role as well. So sorry, it's just a little bit of narrative from within schools.
Thank you very much for that. Councillor Bowden.
Yeah, just first of all, I'd like to thank for being in the report. It's really comprehensive, and it's brilliant to hear about the work that we are doing. I'm wondering though, can we formally, as a scrutiny board, considering that we brought it and we're going to do a working group, can we ask a relevant minister about the actions that the government are going to be taking? I mean, we know recently they are finally acting on a real obvious loophole that they were warned around 3 years ago, which is whilst obviously some retailers are selling them illegally to children, however, they were allowed and are still allowed to actually just give them out for free, because there is a certain loophole that you can actually just give a 15-year-old an e-cigarette and it's not illegal as long as the purchase isn't taking place. And yet we all wonder why it's absolutely risen with children's use, because they were being given out. And it is really great to see what other governments are doing with their stronger actions. And and Councillor Lay mentioned it: change the packaging, reduce the amount of nicotine that is available in the e-cigarettes, and simply ban the single-use ones as well. It would be really strong actions. And equally, it was really quite disappointing because we actually, the government did endorse a company called Juul, who is an e-cigarette manufacturer, about their actions. However, it was widely criticised because Juul has been fined over £1 billion in the US for specifically promoting to underage children in regards to giving them away, using specifically young models in their ad campaigns as well. So I think it'd be really important as a scrutiny board, one of the largest authorities in the country, to ask a relevant minister on what actions are being taken by the government. Thank you.
It's obviously, as part of a working group, we can decide as an action to write to ministers. Obviously, we can't require ministers to attend. That's slightly above our pay grade. Good though, wouldn't it?
Specifically write to, though. I'm not expecting the ministers to turn up.
Why? We are Leeds. But thank you very much for that. Tony.
One thing we've not mentioned is we had a great campaign to stop people smoking, and telling them all along that vaping was much better than smoking. How many parents pass on this to the children? So how many parents encourage children in many ways because there's no danger in it, and rather than you go into smoking, use these vapes? That's one question I would ask. The other thing is, to me, the first action of government should be to tighten the loopholes. I see on page 26 of our papers, the Medicine and Healthcare Products Regulation Agency are not required to check claims made by paperwork and no power to investigate unregistered property. That's one thing that the government could do without legislation. The second thing on there is, I notice that the other loophole is there's no restrictions on shop displays. What about advertising standards? That agency could do something about it. In my local shopping centre, there are 4 shops that sell vapes. They are the ones that have got the biggest advertising signs outside them to say that how wonderful these things are. And the crazy thing is, the last unit to come available was let to another vaping company. So obviously they're the only ones that are making a profit.
I can come in on absolutely agree. I think we can learn so much from what's happened with tobacco. And the big things that made the difference in tobacco consumption were around about restriction of advertising, when billboards went, any print advertising went, any TV and media advertising went. So that would have happened in the early 2000s. This was followed by actions around access. So I don't know if anybody remembers, we used to have cigarette vending machines on the street. Those are all gone. vending machines out of pubs went. So we really, really restricted access to products. We restricted the advertising opportunities. And I think as far as the tobacco industry is concerned, what was interesting is when the proposal to bring in plain packaging happened, the tobacco industry really fought that, because it was almost like their last marketing opportunity had gone with that. And they were designing, we're seeing exactly the same thing with vapes about the designs of these. They're clearly marketed at under 18s, clearly, in the same way as when you looked at cigarette packets, those were clearly marketed at young people. And I think what we do now is it's not adults that take up vaping, it's not adults that take up smoking, it's young people.
What, to wrap up?
Well, I will go to wrap up with them. You're very kind.
Yeah, no, I just meant that. Okay. Interesting conversation. Thank you all. I'm letting you wrap up. If advertising didn't work, there wouldn't be an industry. So we know advertising works, and we have to therefore do something around marketing, distribution and control of vapes, particularly disposable cheap vapes. Other countries are taking the bull by the horns. We already noted that Australia are doing something about it. I think when all the regulations came in for tobacco, and we can't wait as long as we waited for tobacco. We waited nearly 70 years between sort of the mid-1950s when the harm of tobacco became known, and 60 years then before, and we can't wait that long with vapes. There'll be generations of kids who will be harmed waiting for it to happen. My final sort of statement or thought would be there's a lot to go look at, and it's cross-cutting, and I look forward to it.
Thanks for that, Sandy, and thanks everybody for your contributions to the debate this morning. I very much get the impression that there is appetite that we certainly take this forward through to the working group as we've discussed. And in many ways, for me, Councillor Scope's approach of looking at that three-pronged approach nationally, what we want to be saying to national government about having looked at broad evidence where we feel strongly there's action that national government need to take. And I don't think there's anything particularly political or controversial about what are in many ways just common sense views that are, I'm almost certain, going to be being echoed from other local authorities. So there's that bit. There's the work with partners, and I think we'd have to involve trading standards, because we know it's unlawful to sell vaping products to young people under 18. I think we'd want to pick up the issue around gifting, because I think that's a really important point. So I think we'd certainly want to involve trading standards there. Working with any other partners that we feel, particularly health colleagues, around education and rolling out education programs and packages. And then there's the local piece, because candidly, we are Leeds City Council, and there's that question, isn't there? What can we do locally? How can we make Leeds an exemplar city of how locally we tackle vaping in young people? How can we develop a program for schools to educate on the harms in that non-preachy way? Because we know when we tell people this is bad for you, as we've heard very often, and those of us that work in schools know that's the red rag to, oh, it's dangerous, is it? How can we roll out education for parents and carers, so that they're not modelling behaviours that say, actually, these aren't bad for you? How can we tackle the marketing to young people? Are there approaches with planning? Is there scope for a Leeds voluntary code of conduct with shops saying we will not market in a way that specifically targets young people? Can we name and shame those that won't sign up to our Leeds Code of Conduct. Just ideas that I think we want to explore, because Leeds can lead on this. I really feel we can. And I think, as Sandy said, we cannot wait for years and years to tackle what we know is a self-evident harm. So I'm really grateful that we've given this some robust thought this morning. I think it's a really sensible way to take it forward, and we'll take it to that working group, which we'll all be invited to, together with colleagues from Health Active Lifestyle Scrutiny Board, Adults Health, sorry, Active Lifestyle Scrutiny Board, and we'll make sure those partners are there for that, and we'll bring that report back to here for further consideration, debate and consultation. Thank you everybody for that, and we will now move on to item 8. Thanks everybody. I know some people are leaving us at this stage. You know how to live. Okay, I'll just pause for a minute while I have a quick rejiggle. Okay, so we are now moving to item 8, looking at the provision of EHCP support, an end-to-end inquiry onto educational healthcare plans across the city. Looking at the terms of reference. Rob, are you going to speak to this first? Thank you.
Yes, thank you. Thank you, Chair. Yes, so following from the June meeting of the board, our last meeting, there was a broad agreement that EHCP should feature as a work item for this board for the municipal year. Having taken that away, there is now presented at Appendix 1 to this a draft terms of reference, which really is designed to provide a overview of the positions, by no means a final document, and the explicit aim of this item really is to seek views of the board on that and to try and shape the work that the board will undertake. Subject to discussion at the pre-meeting this morning, I think we are looking now at taking a working group approach to this item as well, which may see a slight adjustment to the board's work programme for September, as in this item would come in a working group later in September, which I think hopefully will help facilitate the item and ensure it's brought forward in a fuller way. I think that's all from me, Chair. Thank you very much.
Councillor Pryor, do you want to come in at all?
Nothing really to add at this stage as it's terms of reference, but just obviously we're very keen. The Scrutiny Board looks at this and happy to follow the whichever way the Scrutiny Board wants to do that.
Thank you. Julie, any colleagues?
Just to say that we know that this is a real priority for us, and we know that nationally this is a challenge. I think I've spoken before that I meet with directors of children's services across the country, across core cities, across the region. We're all really struggling, and I think linked to that, as is outlined in the paper, is that rise in demand, so that 118% rise since 2016. I've been meeting with head teachers right across the city in families of schools meeting in recent months. I think I've met with about 15 out of the 18 families of schools. And what is really clear to me is, again, we've talked about the whole system approach in the previous discussion, but is that absolute need for a whole system approach. So there's a lot of work going on. We know there's a lot more work to be done in order that we are meeting the needs of children and families in the city. So it's a key priority, not just for the Children and Families Directorate, but for the partnership. When we think about health colleagues, when we think about other key partners within this, our education colleagues, it's got to have that whole system approach. So really, really happy to have that detailed look, via a working party in September.
I suspect that many colleagues around the table will found the same contacts from residents that I get, which is that real concern around the timeliness of how we deal, not just with the EHCP in the initial stage, but actually the annual reviews. It's not uncommon that you receive an annual review back literally almost to the day when you're due to do the next annual review, which isn't great. I think one of the things that would be really helpful to explore is that how we avail ourselves more widely of digital digital solutions. I know that that's referred to and something the green paper is looking at too, but that's something that would be quite helpful to look at how that might assist going forward. Now, come in, please.
Absolutely. So as you can imagine, some of the challenges that we've got, and we had this conversation last time that we met, really do are linked to recruitment and retention. So some of our key posts, education psychologists, as an example, we've got a national issue in terms of recruitment and retention. So we're really having to think really creatively, how do we grow our own? How do we retain our trainees? How do we create assistant posts? And also partly within that, as you absolutely say, Councillor Cohen, is about looking at digitalisation. So really looking at how can we reduce bureaucracy. Some of the conversations that I've been having with school leaders across the city is the amount of bureaucracy. Really, we don't want our professionals who are there to work with children and families spending time filling out reams and reams and reams of paperwork. That's not the best use of their time. So absolutely, this is an issue that we're looking at right across the local authority in terms of digitalisation to reduce bureaucracy. So we're already having conversations about the potential, for virtual assessments. Obviously, we don't want to, minimise in terms of quality. Our key priority is about getting quality services for children and young people and families, but we have to be creative in the current context.
Thank you, Chair. I'd just like to ask, are neighbouring authorities having the same problem, or is it just a Leeds thing? Because I'm attending governors' meetings and it's been raised as an issue that is just made out to me as though it's just Leeds. Yeah, I thought it was like a national issue. However,
Councillor Renshaw, absolutely. And I suppose that's where I began in terms of, when I'm having conversations, with other directors, right across the country. I was speaking at a national conference last week in relation to commissioning, and actually this conversation was central to that discussion. So absolutely, nationally, regionally, locally, it's a key challenge. We've got a broken system. If you think about, the Send Green paper, the Josh McAllister review, talked about, broken system. What we have is an adversarial system where parents, carers feel that they've got to fight, that EHCP plan is their golden ticket to getting the support that they need to meet the needs of their children, and we need to change that. And really for me, and I suppose when we come on to the conversation perhaps about the terms of reference and the scope, that's where early intervention and prevention is key. That is what is going to make the difference here. What are we doing in our early years settings? What are we doing pre-birth? What are we doing collectively as a partnership? How are we working with health to identify, additional needs for children, and then really simply to respond to them in a really, really timely, effective manner. But early intervention, partnership work is key, and it absolutely is a national issue.
Councillor Stevenson.
Thank you, Chair. Just in terms of the terms of reference, just to capture it now, when we talk about digital EHCPs, can we make sure that we just capture how adults with learning difficulties access that digital EHCP? That's an issue that comes through my inbox quite a lot, and the extra support. And the suggested amendment now for the terms of references, Chair, was at paragraph 7 on witnesses. I understand it's just an indicative sort of the block that always goes in terms of elected members and directors, but I think it's worth capturing now that there are 3 other groups of witnesses that I think are going to be really important for this inquiry. The first is hearing directly from school staff, if possible, Sencos, but senior leadership as well. So somehow through a schools forum or something, if we can get some sort of representation there. I'm surprised that the Leeds Parent Carer Forum wasn't already listed on this list here, given that it's newly formed, and we were told the last scrutiny meeting, the last municipal year, I think, that there was some engagement work going on there. So I think that needs to be logged now. And third is staff reps from the front line, so be that trade unions or others, in that it's obviously fine for us to hear from the top brass what's going on as such, but it's always useful for us to hear from the front line what staff in the council are actually experiencing, so we can kind of understand if there's a correlation between the two. So I think those three should be included now, Chair.
Thank you, Councillor Stevenson. Councillor Hazelwood.
Yeah, just to follow on from Councillor Stevenson, and I actually agree with Councillor Stevenson. That's something that you never thought I'd say, but I do agree that parents, school staff definitely including. As the parent of a child who I'm just about to get her autism and ADHD assessment, and I'm working with the school, her father's working with the school to look at the additional help that she needs because she struggles with the social side of things rather than the academic side, and how a school help with that because she can't cope with a full class of 30. I think it's really important that we hear from the schools, the staff in the schools, and how they're having to deal with this. And that's, I'm not criticising anybody at all. We know that it's a national problem. We know that we need additional funding into this whole issue. But I think it would be really useful to hear from those school staff and how they're struggling to help children while we piece all this together.
Thanks for that. I will add, I am pleased that members of the board suggested both of those, because I would have been quite robustly suggest that. I did raise a mini eyebrow that we didn't have a parent voice, as it were. So I'm pleased we've addressed that. Councillor Pryor.
Again, it must be a full moon, because I also agree with Councillor Stevenson on this. But I just wanted to reassure the board that those kind of parents and staff voices have been at the heart of the changes we've already begun to make. I think it's absolutely right they come to the scrutiny board as well, but I just wanted to offer that reassurance too. We, as a directorate, we're not waiting for the scrutiny board to make changes. We are kind of making those improvements immediately, and those voices are at the heart of that. So I just wanted to offer that reassurance too.
Please.
Yeah, I think as Councillor Pryor has said, we've had a number of, as I've just said, we've had a number of meetings with families of schools, so with head teachers, Sencos right across the city. As a consequence of that, what we have done is established a number of roundtable events, so really focusing on some specific issues and really taking a you said we did approach. But if I think about workforce development as an example, and I think that's a real area where we can work together. Listening, I was at a meeting yesterday with head teachers in the city, listening really about, I suppose, the challenges that they are having in recruiting teaching assistants. And actually, when I hear that they say that the conversation in primary schools, in the staff room is not necessarily about the early years foundation stage or the curriculum. It's actually where can we get the most effective bait guards, because of the level of, I suppose, complex these behaviours, baiting, kicking, scratching, that their teaching assistants and the teachers are having to cope with on a daily basis. This is children trying to communicate, but essentially what's collectively, as an example, what's our workforce development offer to the workforce, because actually, things have changed where we are today in terms of that demand, but the complexity of need. is nothing, you know, I've been working with children and families for 38 years or thereabouts, you know, and I've not seen anything like it. So we're having those active conversations, workforce development, recruitment and retention. You know, how do we wrap around the school? You know, how do we have that multi-agency support for the school? You know, we have the Children and Young People's Population Health Board. One of the things I suppose I'd wanted to perhaps reference just perhaps within the scope is how we do pull in health actually to the conversation, you know, because they are key. If we're thinking about neurodiversity, if we're thinking about, you know, that identification of need, but then that the timeliness of assessments, you know, if we're thinking about transitions, you know, some of these are the key issues that, you know, and again, I would want to reassure you that the conversations are live, you know, and, but I do think that health are a key contributor. And I think it'd be really great to be pulling health in terms of reference in the scope.
Thank you for that. I think it's also important within 6.1, we're just very explicit about the role of SENSAP within all of this. And just, I'm very keen that while it's there in the introduction, that we look in the wider sense around the SENSAP team as well. Thanks. Anybody else? I think we've covered that fairly broadly. We know what we're doing in terms of the working group in September and how we'll move it forward. Anybody else? Okay, thank you, everybody. I think this is going to be I think as Councillor Pryor has said, and we said last time, this is a major piece of work that we want to, by the end of this municipal year, really have some definitive progress and some learning that we can say, actually, this is how we are going to improve lives for young people with additional needs in the city and their parents and carers too. Because as a parent of a child with quite profound additional needs, when this system doesn't work, the stress it causes is significant. We've been very lucky, but I know a number of parents, particularly those who've recently been getting in touch with me since I was privileged to take on this role. There are a number of parents being quite badly let down. I think it's really important that at the end of this year, we have a definitive framework for improving their lives, the lives of their young people too. So thank you for that. Thanks everyone for the contributions. Do that. Let's move on to item 9, annual standards report. Who's going to lead off on this? Don't all rush. Let's make you a run for it. There's some vivid pointing. Aye. Sorry? There's vivid pointing and Rob did, say again?
I'll try to be less vivid, Chair.
We'll pause a moment while everyone just gets themselves ready. And so Dave, starting with you, perhaps the officers who just joined us can introduce themselves, and then Julie, perhaps you'll kick off and then we'll move on. Thanks.
Good morning, everybody. My name is Dave Clark. I head up the Learning Improvement Service.
Good morning, everyone. I'm Jane Ford. I'm the EYFS Improvement Manager.
Good morning, everyone. I'm Sangolia, Senior School Improvement Advisor for Primary.
Just for those watching at home, we are just resolving a small technical issue.
Good morning, everyone. I'm Erica Hines, 0 to 19 lead for school improvement.
Thank you. Judy, do you want to kick us off?
Yeah, thank you, Councillor Cohen. So I'm really delighted to be able to present the annual standards review to you today. It might seem a little bit strange that the report that you've got in front of you covers, I suppose, focuses on data from 2022, when children across the city have just taken assessments and examinations. But that's because our validated data comes in throughout the year, and the last tranche of that comes at the end of March. So what you will see is in the report that it looks back in terms of the last, the last year, academic year, but it also looks to the future in terms of our plans in relation to emerging issues. Overall, it is a positive story for Leeds. We know the catastrophic impacts on Yorkshire and Humberside of COVID, and that we were really disproportionately hit in Yorkshire and Humberside, and also in Leeds. Consequently, the percentage of children reaching the expected standard across the country in various assessments has gone down. What, though, is particularly interesting in terms of Leeds is that it's gone down much less. So really, than the national picture. So this means that where there were gaps, between the national and the local data in Leeds, that actually those gaps in a lot of instances have been closed, or certainly have been considerably reduced. I do want to take the opportunity just to pay tribute to head teachers right across the city and their staff. That's both in our maintained schools and in our academies, for the work that they really, really have done to enable children to make the progress that they have with the learning and with the outcomes. And as I've already said this morning, I've had the privilege of meeting many head teachers, many school leaders in recent months, and I haven't failed to be inspired essentially by their commitment and dedication to the children and families that they seek to support. I would also just like to take the opportunity just to acknowledge the work of our Learning Improvement Service in Leeds. Leeds has maintained this service. It's a relatively small resource, but there's no doubt of the fact of the positive impact that they are having, and I would just want to acknowledge that this morning. Members will also be aware that many of our children enter the education system at a particularly low level of development. The percentages of children who are reaching a good level of development in early years is below the national data. But this is skewed by the lower percentage of those children that are achieving in areas of literacy development. Because of that, it's really important to recognise that in Leeds, we do have a higher number of children who do have English as an additional language, and that they may not achieve a good level of development because some of the early learning goals have to be assessed in English. So where you do have children, small young children who may have had 2 years where they may not have been predominantly around English speakers, that we need to recognise that that may have had an impact on their English language development. Really, I suppose following on from early years, children do, however, make accelerated progress in Leeds. At the end of primary school, we are in the top quartile for progress in reading, writing and maths. At the end of compulsory secondary school, we were in the top quartile for progress, and also our outcomes are by that point in line with national data. So within that trajectory, there are a number of significant outcomes. For example, Leeds is now in line with national data for the phonics screening check taken at the end of year 1. Children in Leeds who took the multiplication table checks in year 4 achieved a mean average score, which was higher than the national figure. the percentage of pupils who are meeting the expected standard in reading, writing and maths at the end of Key Stage 2 was only 1 percentage point below the national. So that's significant. So what we're really seeing is, that gap in particular has been steadily closing since 2017, when the gap at that point was 6%. So there's a lot going on, there's a lot of good things to report on. There's a lot of work that we've still got to do, and we absolutely recognise that. We have had, we continue to have, and we will maintain a focus in this year on our children who are particularly vulnerable and who do have, who we know have identified that they may need, some particular form of support. So we've already talked this morning about our children, with SEND, and also, as I've already, referenced, children who don't have or do have English as an additional language. So I'll leave it there as an introduction, and we're very, very happy to take questions and comments.
So if I may, just by way of clarity, so I'll bring you in a second. What do you mean when you said at the top, you said Yorkshire and the Humber were disproportionately hit? Could you just give us a bit?
It was really in relation to attendance. So what we have seen that through COVID, in terms of attendance, there was a particular issue in terms of Yorkshire and Humberside and in Leeds.
And do we know why? What was worse in Yorkshire and the Humber?
Probably COVID and COVID figures in some ways, but again, that's some of the work that we are looking at. I don't think that we've actually been able to get to the absolute bottom of that, but the data speaks for itself. And in terms of attendance, it is as it is. We were disproportionately affected by attendance in our schools across Yorkshire and Humber and in Leeds.
And it was COVID attendance.
And Erica's to my left is just saying, and it was COVID related attendance.
As I say, there's a piece of work around, isn't there, about why in Yorkshire and Humber we were worse affected than the rest of the country in attendance. Anyway, that isn't for this moment and this moment. Councillor Brown.
Thank you, Chair. I just really wanted to highlight some of the incredible positives in this report. Julie's been over some of them, but just to emphasise, kind of children who took multiplication checks in Year 4 achieved higher than national. The percentage of children achieving the expected standard of reading is improving here in Leeds much faster than it is in national. And Julie mentioned too the accelerated progress in Leeds. So that's progress from Key Stage 1 to Key Stage 2, and also Key Stage 2 to the end of Key Stage 4. Leeds is in Band A. That means children in Leeds are doing better than they are expected to. They are making incredible progress incredibly quickly. And Chair, you work in schools, you know that these incredible improvements in Leeds don't happen in isolation. They happen thanks to an incredible a team effort from Leeds, from teachers and school staff everywhere. And I do think it would be remiss to overlook that only a few hundred yards from here, there are hundreds of teachers currently on strike, demonstrating, the same teachers that have achieved these incredible results in Leeds. And I understand it's over 300,000 across the city, across the country, currently striking over teacher retention, over the cuts of 9% per pupil funding, cuts to children with special educational needs and disabilities, cuts to school buildings, and cuts to pay as well, where teachers are being offered what is essentially a real terms pay cut. Genuinely, in my role with the education portfolio, I've been dismayed actually with the disrespect the government has shown to teachers across the country, particularly in refusing to publish an independent pay body recommendation, the STRB, which, while I understand some of it has leaked, the Secretary of State for Education is still refusing to publish that. And I would like to add my own voice to those calls for that to be published. So I think while we are looking at annual standards, we're looking at some phenomenal work that our teachers have achieved in getting great results for children in Leeds. I don't think we can overlook who has been involved in helping these children achieve those results, and that is those teachers. Thank you.
Thank you, Councillor Pratt. I purposely let you do that. Scrutiny is non-political. I will stop. You've made the point. I've allowed the point to be made. It's noted. We're not going to have an end. We're going to focus on this report. and that's the matter before us. I purposely let you make the point because I think it's an important point you raise, and you've made it. All right. I have Councillor Dowson.
Yeah, the amount of progress children make is actually a result. And I wonder if you could just go through the progress that our children have made as a result.
So just so that I answer the right question, do come in and correct me if I don't. So the progress at secondary is made between the attainment at the end of Key Stage 2, in other words, at the end of primary school, and is compared to the progress that the end point at the end of Key Stage 4, which is GCSEs, and it's in a 8 specific subjects, which are broadly academic, and some vocational subjects can be included in that. So it's not even in just English and maths, we're talking about a whole spread. And that basically pupils' outcomes are compared with the outcomes of pupils with the same starting point. So the pupils at the end of Key Stage 4 are compared with similar pupils who gain the same outcomes at the end of Key Stage 2. I know 0.12 might seem a very small amount. In fact, it's a huge amount. You very rarely get that kind of swerve, that kind of uplift in Progress 8 data. Naught is the norm. I think before once we were something like 0.3 and we were very pleased with that. So 0.12 actually is considerable. To give you some indication, 0.5 would indicate that a child had, well, every child in Leeds had gained half a grade better in every single subject than any other child in the rest of the country with the same starting point. Does that answer your question, Councillor Nelson?
I think that was my point, that we actually do amazing things with our young people, and that Progress 8 as a measure that came in, I don't know, it came in while I was doing the job, is actually a great measure because it shows just how hard working our parents, our teachers, our carers are at progressing children from a starting point. Thank you.
Just to shine a bit more of a light, if you look at page 68, I mean, if you just look at the measures in reading, writing, and maths, 1.16. I mean, see if any something over 1 is excellent. Councillor, covered up my own page now. Councillor Stevenson.
Thanks, Chair. It's probably too late now, certainly for next year if it could, but it'd be quite useful to have circulated as well. In all the tables, they're obviously a summary of Leeds as a local authority. It'll be useful, and we've got the breakdown of demographics, etc. We haven't anywhere actually got the breakdown, if you take like Progress 8, for example, per school or institution in the city. And that'd be quite interesting. I've been trying to find it with the help of Google and I can't find it, but we used to have the link to the government website, and you can see which academies got the highest progress, etc. That would be quite useful, I think, to add context to it, because agreeing partially with Councillor Pryor's comments, it is staff across all institutions in the city who work with children parents to deliver these results, but many do it in different ways, and so it would be useful to look at the ones that have the highest Progress 8, which of course is really crucial, as Councillor Dowson says, because it's measuring progress, not just the best results, so you actually get a pattern across all cohorts, and then for us as a scrutiny board, it would help us then dig down and think, well, actually, as a local authority in the programs that we're running, how do we learn from what's working best in areas, and likewise in the areas with the lowest Progress 8 scores, how do we intervene if we've got, for example, a maintained school that I think I think it was Mount St Mary's at top this year, so that's probably a bad example. But there are maintained schools at the top of that Progress 8 league table. What do we do to support maintained schools at the bottom, for example, that haven't? So it's more of a request. But if anyone likes to comment, look, they could do.
Yeah, that's a really good point, Councillor Stevenson, and we can make sure that's in next year. To provide you some of that context now, of the LA maintained schools, there were only 2 that had no negative Progress 8 data. Obviously, we do look all the time at the data, and we look at the breakdown as well in specific subjects. And with LA maintained schools, we're in and out of them all the time to see the good practice and the areas that need improving. And we link up schools. Just a shout out to Mount St Mary's, because you're absolutely right. They topped the schools for the whole of Leeds. Their Progress 8 score is something like 0.97, which, if you think about it, is a grade higher for every single subject compared to pupils with the same starting points. That really was an amazing achievement. In terms of academies, again, it's a mixed picture. Some academies have very, very positive Progress 8 data. I'm sure you'll be aware of some of them. Some of them had less strong Progress 8 data. So I can't say there was any particular trend about LA maintained schools and academies, but we could certainly put that information in for next year.
Thank you for that. Councillor Heselwood.
Yeah, I wanted to follow Councillor Price's point. It does relate to children's attainment. So I just want to make that you can, but I want to just let you know that. What we're seeing at the moment is a real lack of students enrolling on certain teacher training subjects. Maths is one of them, because of the issues in the profession right now, which Councillor Pryor described. So I won't repeat that. And that will start to affect our children's attainment going forward if we don't have enough teachers in certain subjects for those classes. What is happening is that classes are being covered by other teachers who aren't specialists in that subject because of the lack of teachers. So while this, we've got some good results here, I fear that will affect our children's attainment going forward. I've come off the picket line this morning. I was supervising picket lines, talking to a teacher who's going in for a routine op and is taking his children's, not his children, his class's marking home to do. He has a fit note, but he's going to do the marking whilst he's off. And I did say, you really don't need to do that. I had to give him that advice. And he said, well, if I don't, these results that we're looking at now, the Progress 8, if he doesn't do that marking, those results won't get input and we won't get those figures. We won't get that data. So I just want to make that point that, yes, this is a good report. It's a good set of results, but it's coming at a cost to our members of staff in schools who are really having to bend over backwards and are really, I think, at the end of what they can deal with sometimes to make sure that our children are achieving and we are getting these good results.
I think you make some really good points, Councillor Heselwood, in terms of the feedback that we're getting from, so we're talking with school leaders and teachers consistently, and the feedback around recruitment retention is significant, and it's not just a Leeds issue, it's a national issue. I think one of the things that we're keen to do as officers is to work with, when we have opportunities to speak with DFE and regional directors around the issues that head teachers are telling us about in their schools, because that recruitment retention issue is a significant problem going forward. For us to influence the sort of decision making at that level as well, and to share those views with appropriate people that, from the views from like school leaders about their schools. So we'll do all we can to push on that one.
I just want to come in on that point as well, because certainly in my conversations with head teachers, Senkos, others recently, we've got the issue with recruitment. We've also got an issue with retention. you know, and actually, you know, when our teachers, our school staff, our teaching assistants are, you know, doing their utmost, getting up every morning, every day to do their best to, you know, meet the needs of the children in front of them. When we're seeing that complexity of need, you know, we need to recognise the impact on them, both professionally and actually on their personal lives. So some of the things, you know, we've been talking about is well-being. You know, if you think about social workers as an example who receive professional supervision, you know, where there's a space for them to talk about actually how their work is impacting on them personally. So I think that's what's been really valuable, again, about having the conversations. You know, certainly, again, we've got some examples within the children and families where some of our colleagues have created space, they've called it Hearts and Minds, but actually, you know, a safe space for them to come together to actually talk about their feelings, you know, to talk about how am I feeling, you know, how is, you know, when I'm trying to do my utmost, trying to do my best, but I feel that at times I can't for a whole host of reasons. How does that make me feel? So I think, you know, the conversations that we've been having recently are really, really valuable because we need to think differently and we need to do differently. So, you know, we will be thinking about that within the local authority, but also thinking about that in an ongoing conversation with our school leaders about, you know, how do we respond to that? How do we create that space? You know, do we have some skills within the local authority? You know, perhaps, you know, we've got, you know, clinicians, others who have some particular professional expertise that could be useful when we're thinking about feelings, hearts and minds and well-being.
It just add to Councillor Heselwood's point, Julie's point, and actually even relating back to the previous discussion we had on EHCPs and the 118% rise we've had in those. I was chatting to a teaching assistant last night in Councillor Edwards' ward, actually, who was talking about some of the difficulties she faces in the classroom. And before COVID, you know, a class of 30 kids may have had a teacher and a teaching assistant and maybe 1 or 2 children with additional needs. Post-COVID, now the same teacher and teaching assistant will have 5, 6, 7 maybe children with additional needs, but the same number of teachers. It is just increasing the complexity of what it means to be a teaching assistant, and that additional burden on teachers, it making a much more difficult job, is really being felt hard in the profession. And that's why when we have such a positive annual standards report, it makes it even more impressive that these results have been achieved, but we can't view them in isolation.
Thank you. I just wanted to pick up a little bit on the wellbeing issue. We've as part of the 3 A's strategy, we focused on wellbeing, particularly around head teacher wellbeing, support for the head teachers, because it's the head teachers that are then needing to support their staff and their communities, and which puts a huge amount of pressure on the head teachers. So part of our focus has been trying to make sure that we, as best we can, support our head teachers through our head teacher support service, through the networks that we have with them. We're doing, for example, we've got a primary head teachers away day come October, which has got a focus on, it's for primary leaders, academies and maintained schools, with a focus on their well-being, because we know how important head teachers, school leaders are, the pressures that they're under, and how they support their staff and their communities. So I think as a directorate, part of our focus has been to harness the capacity that we can to support our school leaders.
Thank you for that. I think I've been involved in education for 20 years plus, in fact, certainly plus. There's no question from my view that post-COVID, the classroom environment has got more complicated, far more complex, far more diverse, a far greater diversity of range, even within set subjects. The scope from within a class, from more able to less able, the diversity of need, the vulnerability of learners within the classroom environment, and actually also the tolerance of parents and carers has also altered, and the immediacy of parents and carers coming to school with concerns has altered as well, and the trust sometimes of parents and carers to trust education professionals that they know how they're handling it. There's post-COVID, there is a change in environment, and I agree with much of what's been said. Councillor Monaco.
Thank you, Chair. Just in terms of retention, I was just wondering whether is the department possibly looking, I do appreciate that, you know, we do have great teachers and, you know, the whole system is really great, but are they looking at maybe external in terms of overseas, just like the NHS will do? It's just a question, really.
So we certainly have looked at that, and we have progressed that within the directorate in relation to other professional roles. And I suppose that's been within our gift within the directorate, but certainly in the conversations that colleagues have been having with head teachers and education leaders more recently, that's exactly the sort of thing that we need to be working on. And also just thinking about, you know, how we think outside the box in terms of collaborative working. You know, I don't know, but is there something about an academy for Leeds? You know, is there something about, you know, we talked in the meeting that I was in yesterday about newly arrived families in Leeds, you know, certainly within our children's centres. We've engaged, you know, people from the community who've newly arrived, who've got a whole host of experience in bringing up their own children into volunteers and then moving them into apprenticeships and moving them, you know, one day to be the manager of that children's centre. So I think there's something about, you know, I suppose the flavour of the conversations that we've been having recently is, you know, nobody's sitting with all the answers. You know, what we need is that collaborative approach. We need to create space where we can be creative and think innovatively. You know, I suppose in a time when we're probably all doing more with less, we need to think about how we are using the resources that we've got in a different way.
Thank you.
Thank you. Councillor Edwards.
Thank you, Chair. On page 53 of the report, talks a bit about the difference in terms of levels of development. So it talks about the difference between girls and boys. And there's also, and then the next paragraph, it talks about the differences between autumn-born children and summer-born children. So I was wondering if you could give a bit more context to that, please, and also say a bit about what's being done in these areas. Thank you.
I can come in there. So in terms of the reception assessment that happens at the end of the reception year, the children are often in that reception year, children will be could just be 4 or could be almost 5. So actually the term of birth makes a massive difference in terms of levels of attainment for those children. And actually research shows that often continues on when children go into primary, secondary, and sometimes into university level education as well. But certainly I think if we look at children within that reception year, months of birth make a massive difference, because we can be looking at almost a quarter or half of that child's of a whole year can make a sorry, I'm not explaining that very well. In terms of a 4-year-old and a 5-year-old, we can be looking at an almost 12 months difference. So I think it's almost the levels of experience and levels of time that child might have had in preschool will vary enormously. So it's almost to be expected that for children with different terms of birth, that those levels of attainment will be quite different. It doesn't follow for all children, but there is a general pattern. And it comes in terms of emotional well-being, social skills. Those language skills often can develop enormously within just that final term in school. So that generally is the reasoning behind that.
Thank you for that. Councillor Renshaw.
Thank you. I'll just follow on with another Jane, because I know that the children in early years definitely have struggled, especially throughout lockdown and COVID. However, the goalposts by Ofsted have also increased the pressure put on those children because the expectations have been tightened. And I'm just wondering what we're doing in Leeds to try and support those young people, because laying the foundation years is important for the rest of their school life and something that can impact them in those first 7 years can have a tremendous effect on what happens to them throughout the school. So I just wondered what Leeds were doing to ensure that those children in early years were getting the best quality and support when the level of staff and the increasing number of staff required is obviously fallen.
I think what you've said there is very true. I think we're doing a lot to support our providers, and I think what we have to remember is we've got about 1,000 early years providers in Leeds. So we do have our children who are in early years settings within schools, but we also have childminders, private and voluntary settings, preschool playgroups. So there's a whole range of providers, and we have a fairly small early years team, so six full-time equivalents working with those 1,000 providers, but we do provide particular support to settings who might have had an RI or an inadequate judgment. We give them really focused support for a period of time to support them through that Ofsted period of re-inspection. There's a whole suite of materials and resources that we provide to support early years settings. Obviously, we have our training offer and our advice and support and consultancy offer. So there's a whole range of things that we do to support providers, and we're here as to give advice and support. We operate, we have regular discussions with providers in terms of our we have termly network meetings with our PVI providers and our childminders. We have termly meetings with our early years foundation stage colleagues so that we can keep them well informed. We can answer any queries or questions, but also you mentioned Ofsted and how there have been some changes in the expectations so that we can keep people as well informed as possible, share really good practice with providers, and offer whatever support providers need to do that.
It's just that the Ofsted seems to have tightened and the expectations have increased on those children in early years. And I'm just wondering what effect that's having on the rest of the results, or how we can project what those results will be, because obviously they won't be reaching the targets because they need that emotional support as well, and the families need the support. And I've recently spoken to some childminders in my ward, and I know that they find it difficult to always log on to the available training because they've got children there and they're looking after the children, so they don't feel it's fair to log on to the training. So I'm just wondering what we could do about that to possibly make it easier.
So I think you've highlighted a really important point there, and we've got about around 600 childminders currently in Leeds, and obviously many of them are working alone, and during the day they're not able to access training or support. So we ensure that any training we offer is on the evenings or on Saturday mornings. We often offer training to groups of childminders who will come together as a group of childminders in a locality, and we'll go out and deliver training to them at a time that's convenient to them and in a location that's convenient to them. I think you also there referred to changes around Ofsted, and I think that's been particularly challenging for childminders who are working alone. There have been changes to there's been more focus put on teaching and learning, and I think perhaps for childminders that have been doing that role for a number of years, that's been quite a big shift. But there is an awful lot of support, and so if you do know of any childminders working within your ward who want additional support, please share our details, and we're really happy to offer further support at a time that's convenient to them.
Thank you for that. Councillor Stevenson on consideration of this report, and then we're going to move on to still on this item, but there's another bit we've got to consider. So Councillor Stevenson.
Thanks, Chair. On page 75, table 36A, it breaks down the Progress 8 scores based on ethnicity. I find this quite interesting because when we're normally given tables on ethnicity, when, for example, when we discuss poverty, you tend to find that for various different reasons that ethnic minorities tend to be higher up the poverty scales. Yet looking at this table, it's quite remarkable that, for example, to pick one out, Asian Indian pupils have a Progress 8 score of 1.11 above the average, compared to, for example, white British at 0.02. So this is obviously a success story. So what's behind that? What's the work that the local authority lead on in order to achieve some of those results in schools and academies?
We have a fantastic Closing the Gap team who do a range of work. Some of it is actually detailed in this report. So there's regular EAL networks. There's lots of training that they provide, both in person and sort of e-module type training. There's very focused work as well. So for instance, the change to GCSE in maths and science led to quite complicated sentences and English in the actual GCSE texts themselves. And often that could be a barrier to pupils achieving well. So they're doing very focused work about how teachers can help children who have English as a second language break down those particular that wording. So there's big focus on vocabulary. There is a whole new EAL strategy which my colleague Jadine Farrell is working on. It's really comprehensive, and that would give you, I can send you a copy of it, and that would give you a really good overview of all the work streams that she and her team are involved in and have been involved in for quite some time, supporting pupils. I also have to say that a lot of schools have absolutely fantastic provision for pupils who are new to English or new arrivals. So, you know, Leeds City Academy, Lawnswood, absolutely fantastic provision, which I've been lucky enough to see. Lots of other schools, I'm sure, have that as well. I just haven't been in there and seen that in particular. So I think those are some of the reasons why those scores are robust and strong.
Thank you for that, and thank you all for the comments. I think for me, the strength of this report is that it doesn't say everything is rosy in the garden. It rightly reflects on where some really strong results have been achieved. But I really welcome the fact that for every section there is this is what we're doing to take us further. I don't think anybody involved in education would ever say what we're doing is good enough. I think if any of us say, oh, it's all fine, we need to review what we're doing. So I really welcome the fact that even where things are good, we're saying, actually, this is how we're going to drive it better. And then in terms of, I'm thinking particularly looking at the post-16, for example, where the report accepts, which is one I've not focused on it, that actually there is room for improvement. Although I'd be interested to see this year the Progress 8, because I think that might be more reassuring for us. That's purely looking on experience. I think there's some focus there potentially needed, and again possibly just again then the early years as well, how we really build on that. So thank you very much for the report. Can I invite colleagues to turn to page 47 of the bundle? It's the first page of the appendix, marked out, highlighted. Is the refreshed 3A's plan, which runs until August 2023, and the 5 priorities within that. Because you'll note one of the things we're asked to do is, following consideration of the report, to consider what might form the priorities in a refreshed 3A's plan for 23-25. So I thought it might be helpful just to have a few moments specifically on that, certainly rather we'll make sure we put some time onto that. For me, I'd like to see us reflecting, as I said, some of the work needed within early years, and again within post-16 too, as to how we're really going to drive improvements there. But please, colleagues, go for it.
just thought it might be worth saying, Councillor Cohen, we've our initial discussions around the 3 years refresh, because we're meeting with different stakeholders around that now. Some of the priorities in there are still very relevant, so it's not that all of them will just disappear because they're all done. One of the ones that we've had significant discussion around is about the reading, because reading is the core to progress, but we think some element of widening that to early communication and language skills as well as reading, which ties in with the data and the evidence that we're looking at in terms of early years and their early progress. So I think that one, from our point of view, and we're still in that process of gathering views, and we're interested to hear what Scrutiny say about that, but early communication and language as well as reading. There's also one of the things that we feel that will be included or should be included is around the NEAT agenda, because it's a priority for the city. So, and I think, excuse me, the one thing that we've been discussing around, because early years is such a priority, is how we fit early years into more of the target. So rather than a separate one, it becomes integral to all the bits that we're doing around SEN, around communication and language and so on.
Thank you for that. It was actually really reassuring to see in the report the work around reading fluency project into Key Stage 3. Anybody involved in high schools will know that reading fluency is such a challenge, and it's the most basic of keys to accessing curriculum. You know, young people who are struggling with reading, not just straight decoding, but actual interpretation and extrapolating, where they're struggling, that the ability to access deeper curriculum can be such a barrier. So really pleased to see that.
Yeah, I think we would agree, and it's brilliant to see so many of our secondary maintained and academies working really hard on that whole reading focus into Key Stage 3, and they're doing a lot of work. And I think it's where we can support in terms of that, extending that reading fluency project into Key Stage 3 will support them in the work that they're doing.
You rightly picked up on some of the concerns about post-16. I just want to add a bit of a caveat, because that tends to be a lot more volatile because you've got smaller numbers. And if you had a look at the annual standards report for 2019, you'll see that the applied general was more negative, and this year it's more positive. What we don't have, unfortunately, this year is any progress data, because normally there's the value-added data from GCSE to the end of A level, and because GCSEs were based on teacher assessment, that didn't exist. So whilst we will continue to look at post-16, I don't want to overemphasize that, because actually we don't have the data to make to draw the conclusion that's a very real problem. But obviously there are improvements that we can make in that area.
Yeah, I think, well, I hoped I brought that out in my introductory comments. I said, just based on the schools I work with, my guess is if we were being able to do progress 8 data, it would have given us some reassurance. Just looking at, but I'm always anxious that post-16 is that last part of the educational journey, and for me it's just really important we don't lose sight to make sure that we're giving the absolute best chance to young people to access the wider world. Yes, Councillor Pratt.
It's probably worth mentioning as well, I attended the Scrutiny Board on infrastructure investment and inclusive growth last week, which is looking specifically at some of those NEAT figures in the post-16. It's certainly a crossover between this Scrutiny Board and the other, but I just wanted to reassure that is being looked into as well.
Thanks so much. Any other thoughts just to help feed in to officers on anything around the 3A's plan? Obviously it's 23 to 25. Anything else at all? Well, I'm sure if colleagues, so I don't ever like putting people immediately on the spot. I'm sure if colleagues do have things, they will make sure they communicate that through to you. Thank you all very much for that. That was a really helpful debate. Thank you very much indeed. We will have a 30-second pause and then we'll move on to item 10. Okay, everybody, thank you. We move on to item 10, Sacre annual report, which is at page 83 of your bundles. So this is the Standing Advisory Committee for Religious Education. Dave, are you going to?
I think Eric is going to introduce this one, Councillor Karen, if that's okay.
Oh, completely new.
Oh, sorry. Oh.
Yes, thank you for considering this report. Sacres have a duty to publish an annual report, which has to be sent to the Secretary of State for Education, and it should be distributed to key partners such as councillors. This is our annual report for 2022. I'm sure you've read the report and you can see the wide range of work that the Leeds Sacre have undertaken. I thought I would just highlight some key points of that work and that members might find interesting. So we do have an LA agreed syllabus, which has to be followed by all maintained schools in the city, and academies can choose to adopt it should they want. It runs for 5 years and it's due to be updated in 2024. So work on that is already underway. The content will remain broadly similar to what's in the present syllabus, but it's going to be structured around some big ideas. Pupils will learn about several religions, but know about particular aspects of them in depth. A strength and post-16 part will be added, which includes some case studies, and units of work will accompany the syllabus as well. During the last academic year, our Sacre consultants sent a survey to all Leeds secondary schools to review the time made available for RE across Leeds. All schools received an individual response to their survey, and where necessary, targeted support was provided. And a similar process has taken place this year for primary. The annual report always contains details of the RE GCSE results. So in keeping with the overall results for Leeds, the RE results were very positive. 79% of pupils gained a grade 4 or above, and that was 3% higher than the national figure. And the Progress 8 figure was very high at plus 0.38. Our 2 Sacre consultants provide a wealth of training, which is detailed in the report. We have termly and secondary RE networks, which run in tandem with Kirklees and Calderdale, and regular newsletters go out to RE teachers. Our consultants this year have drawn up 2 really helpful documents for teachers. The first was called Sensitivity to Faiths, and it provided practical information to schools to support them in their work. The second, which was called Voices and Viewpoints, offered a range of viewpoints from across our area about specific areas covered in the RSHE curriculum, which at times can be contentious. So our consultants have also worked to increase pupils' direct experience of places of worship. They've drawn up a directory of faith visits and visitors schools and settings can access. They also secured a grant in 2022 to make 2 short films this year to introduce young people to a Gurdwara and a synagogue. These are now completed and they're going to be offered to schools alongside supporting materials and the option of a live session with representatives from that faith community. And we're hoping to develop more films to develop children's understanding of other religions. So I hope that gives you a brief overview, but I'm happy to answer any further questions you might have.
Thank you. Before I open up to questions, can I just take a moment to say a huge thanks to everybody on the Sacre committee. Particularly, we have a new chair. It is a particularly challenging area to deal with, dealing with the curriculum and how schools deal with faith. And I just want to say a huge thank you for the work that they do. Councillor Pryor.
Okay, Chair, I was going to say exactly the same thing. To put on record my thanks to all those involved, including the councillors who sit on Sacre. I think it's an incredibly important piece of work. Learning about different cultures and different faiths that we have in the city is essential. I think in Leeds we do cohesion very well. It's not to say everything's always perfect, but I do think this is a core part of that. As Erica said, the syllabus is put together for maintained schools, but actually the vast majority of secondary academies have actually adopted the local agreed syllabus, as well as what's been put together being used in Bradford and Kirklees. And I think this pays credit to how strong this piece of work is. So just wanted to put that on record as part of an introduction.
Councillor Dowson.
Don't want to labour the point too much, but it really is a fantastic organisation. I sat on Sacre, Sid nods there, for many years, and it's full of the most wonderful, wonderful people. I see there's quite a number of vacancies, so the plea would be to try and fill those vacancies. I sat next to an absolutely wonderful chap who was a Jane, which I always found quite funny, being a Jane myself, in name only, but you know, it's wonderful. And I just wanted to refer down to point 4 on page 5 about promoting understanding and tolerance. It really is the most fantastic organisation for doing just that, and I would commend it very much. Thank you very much, Chair.
I think sometimes the sensitivity needed to build these curricula are sometimes not immediately apparent until you start to try to do it. And the challenge of genuinely not alienating, it really is a superb curriculum, and all credit to those that both put it together. And then let's not forget, at Allerton, I'm the lead governor for humanities, so I did my link visit with our RE department last week, and the delivery and doing the delivery right is so important as well. To all those staff that then deliver what Sacre put together, huge thanks to all of them. Questions, comments?
Just a quick comment. I think it is done really well. I was on many school little trips out to various settings, you know, and I learned a lot as a parent, and I had to go on the website to find out some more stuff as well. So I think it can, you know, give education to parents about different aspects of religion as well as the children. And I thought it was really good because I visited lots of places, but it was mainly in primary school I visited them, not in high school. High school, I didn't get as much as a parent back, but I thought it was good at the time.
Thank you, Chair. And I'd like to add my thanks as well. I'm interested in the strategy that you're taking, because obviously all of us represent quite different wards in terms of their composition, in terms of the different faith communities that we have within them. So I'd be interested if you could say a bit more about how tailored the approach is from ward to ward, because the dynamics will of course be different, and also what opportunities there are for people in wards where perhaps there is less religious diversity, or where there are fewer sites for places for people to worship. So for example, there'll be some wards like mine where there are quite a few churches, but for example, no mosques or no gurdwaras. So what opportunities are there for children and young people growing up in places like my ward to find out about the diversity within the city?
The whole point of the the faiths list is that any RE teacher can consult it and therefore broker a visit to the place of worship or ask a visitor to come in and speak to their children. So that would be the best route for any school in any ward, regardless of the immediate locality of places of worship. You're absolutely right. It's a huge focus now, quite rightly, through in schools about tolerance and faith of religion. It is a fundamental British value. It is one of the things that we check out when we go into schools and we ask pupils questions about their understanding of religions and faiths. This particular syllabus does have a broad sweep of religions that we cover. They do reflect the religions that are commonly followed in the West Yorkshire region, because it is a syllabus for West Yorkshire. Schools always do have some autonomy, so they broadly follow the syllabus, but there are different emphases that you can make according to the particular context of your school. And schools are very adept at that, particularly schools that know that they have a challenge because they have a predominantly white population.
Thank you for that. Any other questions or comments? No? Well, thank you very much indeed for bringing the report. The recommendations for us are to note the contents and recommendations set out within the appended report, which are at page 105, which we have done, particularly item 3, to ensure the annual report is considered carefully by the scrutiny panel of the council and its contents noted, which we have duly done. Thank you very much for that. We move on to item 11, work programme. Sir.
Thank you, Chair. Just to touch on a few issues that have arisen today. So I'll be contacting board members regarding the planned work programmes on, working groups rather, on the vaping issue that we debated today, and also the EHCPs. So that's something that I'll get on with this week, and you'll hopefully receive an email from me with suggested dates and inviting you to attend. Most likely that will take place, I think, logically after the summer break, but I will nevertheless send it out as soon as I can. Just a couple of things from the last meeting. I think site visits were mentioned. I have made initial contact with the director on that, so I do plan to service visits or visitor services actually related to the Youth Justice Service that we talked about. So I'll be following up with that as well. So there's a bit of stuff to come from me in terms of organising both working groups and site visits. Further to that, I think that's everything, Chair. Thank you.
Thank you very much indeed. So our next meeting is Wednesday, the 6th of September. Remember, the 6th of September, at 10 o'clock with our pre-meeting for board members at 9:30 a.m, which means that's it for this scrutiny board in terms of formal meetings before summer. So I do hope you all have an amazing summer. Hopefully it will be a slight improvement in the weather. You all have a good rest. Obviously, we have full council next week as well. That's it. Thank you very much, everybody.